Hey everybody, Organized Biology here. Today we're going through NCLEX review number 3. We're going to be discussing physiological adaptation for this first one, so let's get started. Which finding most likely indicates breast cancer during examination? So we're looking for breast cancer indicators. So we've got slight breast asymmetry, a fixed nodular mass with dimpling of the skin, bloody discharge from the nipple, and then multiple firm, round, movable masses that change during the menstrual cycle. Okay, so first one, slight breast asymmetry. This would not be an indicator. This is a normal anatomical thing for many women. Their breasts are slightly asymmetrical. That's completely normal, just like all of us. They're just a little bit off, right? Now, B, a fixed nodular mass with dimpling of the skin. This is the primary indicator for breast cancer. The reason we see this is because it is fixed. That means the tumor is literally growing in one specific area and it's not moving. That means that the cells are rapidly dividing and growing and they're sticking in one place, and that usually indicates cancer. Usually we also see some sort of dimpling or out protrusion of the skin, and that's the second characteristic of breast cancer when we find it in a breast examination. Now, C would not be correct. This is actually relatively common due to what's called intraductal papillomas. This literally means within the ducts of your mammary glands, we have a little tumor. And now you hear tumor and you might get scared. This is just slightly abnormal growth of the epithelial or the lining cells around the ducts themselves. Sometimes they grow a little too much and that pressure can cause a little bit of bleeding and discharge from the nipple. That's usually pretty normal. Now, it can be an indicator for breast cancer in very rare cases, but it's usually not the indicator, okay? The last one, multiple firm, round, movable masses. Here's the thing, this would not be correct because this is actually normal changes during menstrual cycles. This is called having a fibrocystic breast. This basically means just kind of a buildup of fibers, okay? And this occurs with normal changes of hormones during the menstrual cycle, okay? And the big thing here is that they're movable, okay? They are just moving around, and so it's not like it's fixed in one spot. That's the key indicator of cancer. All right, next up, number 2, which is the primary nursing diagnosis for a patient experiencing a migraine headache? Not fun. Number 1 is acute pain due to biological and chemical factors. We've got anxiety related to this health change, hopelessness related to this deteriorating condition, or D, risk of side effects related to medical therapy. Now, this is one of those times where we're looking at what is the main problem we are trying to fix or solve, or in this case, diagnose in this example. So when we're looking at these, the main issue that we will see with a patient with a migraine headache will be that acute pain related to those chemical and biological factors. Now, sorry, my dog wanted to say hi to you guys real quick. This is Gracie, so subscribe for Gracie. So as we go through the rest of them, look at this. Anxiety, hopelessness, and risk of side effects basically after medical therapy. These are all subsequent things that we will address, both with bedside manner, with this anxiety and hopelessness, but then once we try to deal with the pain, the main issue, we will have to look at the risk of side effects related to the medical therapy that we will provide, but that wouldn't be the very first thing that we will diagnose here. So that's why A would be the best answer, although these will also be included in the care process. All right, everybody, last one here. We've got a 32-year-old mother of 3, and she's diagnosed with hypothyroidism, so low thyroid levels, right? T3, T4. She enters the clinic with 3 sweaters on, bradycardia, slow heart rate of 52 BPMs, and complains of 40 pounds of weight gain in the last 3 months. So which is the highest priority diagnosis you will make? So whenever we're looking at highest priority diagnosis, we're looking at the things that will really bother her in both the acute setting, so immediately, as well as in the long run. So let's look at these answers. A says impaired mobility due to low endurance. So although she will have low endurance, she has low thyroid levels. So therefore she's gonna be a little exhausted, but she's coming into the clinic just fine, and her impaired mobility and her general tiredness isn't really a big threat to her overall health. So we're not going to focus on this one as the highest priority. Now B, hypothermia related to low metabolic rate. You would think, hey, hypothermia is a bad thing, but here's the thing. We don't see any other indications that she is hypothermic, right? She doesn't have blue skin or she's not shivering, etc. So all she has is a couple of sweaters on and she's cold, okay? So she's feeling cold, but that's not going to majorly impact her health in the short period of time. So we're not gonna focus on hypothermia here, although it could be an issue in the future. C, disturbed thought process related to interstitial edema. Now, what's interesting about this one is this is an indicator of something, and it's actually going to be related to D. But the disturbed thought processes themselves are not the major issue here. The major issue here is decreased cardiac output related to low heart rate. Remember, she has bradycardia, so she has a 52 BPMs. That's normal for high endurance athletes at rest, right? But we've got a mother of three. She's gained a pretty significant amount of weight, and she has interstitial edema and fatigue. That's usually related to the heart, so the cardiac output, not getting blood to the tissues and back to the heart and then to the lungs and back to the heart and so forth and so on. So this would be the biggest issue. So what's happening here basically is the T3, T4 regulates your general metabolic rate, including the metabolic rate of the heart. If the T3, T4 levels are low, the heart rate will also decrease and the cardiac output will decrease. We've got to perfuse blood to the entire body with the heart pumping. So if we can't get that blood to the tissues and back to the heart, that will be the main cause for concern. So we're going to make this the highest priority diagnosis. Hey guys, if this has been helpful at all, please subscribe to the channel, like the video because it's a really nice thing to do, and I appreciate your support.